Welcome to my presentation on asthma. My name is Melissa Lagunas, and I'm very happy to be able to discuss this disease with you. So what is asthma? There is no set definition for asthma because researchers are still trying to figure out why exactly it occurs. They do agree, though, that asthma is a disease where the airway becomes obstructed. On the picture on the left, we see the pathology of asthma. On the left, we see a normal airway. The muscles are relaxed and the airway is open. In the picture in the middle, we see the normal state of an asthmatic person's airway. The walls are inflamed and thickened. The picture on the right, we see the airway of an asthmatic during an attack. You see that the muscles are tightened, air is trapped in the alveoli, and the walls are even more inflamed and thickened. The constriction of the airway makes it difficult to breathe. It is characterized by coughing, wheezing, and chest tightness. There is no cure for asthma. It is a chronic disease, but we do work to reduce the symptoms and make life a little easier for the asthmatics. So what other complications can occur from asthma? Asthma does not just affect the lungs. It can also cause allergic conjunctivitis of the eyes, middle ear infection, hypersensitivities or allergic reactions to foods, allergic rhinitis, which is a medical term for hay fever, sinusitis, which is the inflammation of the sinuses, which occurs from allergic rhinitis, and on the throat, pharyngitis can occur with allergic rhinitis, along with food hypersensitivities. So why is asthma a big deal? Asthma affects over 300 million people worldwide. About 10 to 12% of these people are adults, and approximately 15% of these are children. In childhood, more males have asthma than females, but when they become adults, we'll see that it about evens out between males and females. There is a direct relationship with increased modernization of the community in the areas and an increase in the number of those affected with asthma. Asthma is not usually deadly, but it can be very scary. Asthma also has high costs related to medical treatment and hospitalizations. Annually in the United States, it costs $56 billion to lost wages and overall lost productivity. On the cartoon on the right, you can see the doctor telling the man, "I'm afraid neither your insurance nor your immune system will cover it." There are many risk factors for asthma. You can be genetically predisposed. If mom, dad, somebody in the family has it, then you're more likely to get it. If you have allergies, you're also at higher risk. More male children than female have asthma compared to in adulthood where the numbers even out. Non-Hispanic blacks are also at higher risk. It is very important to maintain a proper diet because obesity is another risk factor. Pollution, indoor allergies, outdoor allergies, frequent exposure, passive smoking, these are all things that we are exposed to that can also trigger asthma. If you have respiratory infections and are taking certain medications, you are also at risk. So how does asthma work? Risk factors and trigger exposure can cause tightening of the lung muscle or bronchoconstriction. The tightened muscles constrict airway as well as inflamed, thickened airway walls. Mucus is also formed inside of the lung vessels, which is also decreasing the amount of airflow in the person. This limited airflow leads to a decreased force and amount of air. A person can become scared and they can panic and have more anxiety when they're having one of these asthma attacks. That is actually one of the triggers for asthma, which brings us back up to more bronchoconstriction. Coughing, wheezing, and inability to breathe all result from the decreased force and amount of air. Without proper treatment, without proper medications, death may happen from the inability to breathe. There are many medications used for asthma. Bronchodilators work on smooth muscle in the airway to decrease constriction, but they do not work on inflammation. These are called beta-2 agonists. Albuterol and terbutaline are examples of bronchodilators that are used as needed for the symptoms. These are rapid acting. Salmeterol and formoterol are long-acting bronchodilators. Side effects for bronchodilators are palpitations and muscle tremors. Bronchodilators are usually used with corticosteroids. Corticosteroids are used to decrease inflammation in the lungs, but they do not affect the exact cause of the response. Steroids are more effective for any severity, any age, so they are more widely used. Corticosteroids can be taken by mouth or through an IV. Two common medications are methylprednisolone and prednisolone. Side effects for steroids are obesity, bruising, osteoporosis, diabetes, high blood pressure, stomach ulcers, depression, cataracts, in older people. It is very important for women to monitor their bone density, as corticosteroids can cause the osteoporosis. Anticholinergics decrease bronchoconstriction and decrease mucus secretion. Tiotropium bromide is an example of an anticholinergic medication. They slow the onset of bronchodilation. Side effects of anticholinergics are dry mouth, urinary retention, glaucoma in the elderly. Theophylline is also used for asthma. This possibly switches off anti-inflammatory genes and makes steroids more effective in severe asthma. Aminophylline is an example of this type of medications. These are less used due to the fact that beta-2 agonists are more effective. These medications are taken as needed for symptoms. Side effects include nausea, vomiting, headache, sweating, and palpitations. It is very important to check blood levels because high concentrations can cause cardiac arrhythmias, epileptic seizures, and even death. Other medications that are not commonly used due to increased amount of side effects, not being as effective or being more expensive, are anti-leukotrienes such as montelukast, chromones, steroid-sparing therapies, and anti-IgE medications. A person can easily look online for home remedies for asthma. Here are 3 examples that I found that were kind of interesting. The first one, you put some mustard oil in a pan and add a little camphor. The mixture is then heated and transferred into a bowl. When it is comfortably hot, massage your chest and upper back with it. Kind of like Vicks. The second example, you wash 3 dried figs and soak them in a bowl of water overnight. In the morning, you eat the soaked figs and drink the water on an empty stomach. The third example I have for you, you take some ginger juice and add the same amount of pomegranate juice. You then add honey in the same proportions. You then eat 1 tablespoon of this mixture 2 to 3 times a day, including exercise. Minimal to no adverse effects from medicine is optimal in monitoring the effectiveness of treatment. Here is a chart that indicates asthma control. Please take a little time to review it. So what can reduce a person's risk for asthma? In my research, I found that immunity through exposure is one of the ways. Something that I found that is not very likely, and I don't think very many people want to try, is having intestinal parasites. That also reduces the risk for asthma. The more logical thing, the best thing for everybody though, is prevention. Exacerbations of asthma. First of all, we want to avoid triggers. We can do that by using the AC, making sure that the home is cleaned well, covering the mouth and nose if it's cold outside, reducing pet dander if you have dogs or cats, and maintaining proper humidity. Staying healthy is also important in preventing asthma exacerbations. We need to get regular exercise to strengthen your heart and your lungs. You need to maintain a healthy weight, and you need to control heartburn. Healthy eating and diet modification are also very important in preventing asthma exacerbations. You need to increase vitamin D, eat more fruits and vegetables, decrease sulfites, which is wine, dried fruits, pickles, fresh and frozen shrimp, and avoid any other allergy triggering foods. Education is very important in controlling asthma. A person must know the risk factors for asthma and the exacerbations. Smoking cessation is also very important. Reduction of noxious environmental exposures is something that also must be taught. A person must also maintain their immunizations, such as influenza and pneumococcus, and it is very important for a person to try as best they can to not get sick. A person must understand what asthma does and what their life looks like in the future with the disease. Medications must be taught as far as dosage, the benefits of the medications, and the adverse reactions. A person must also know how to properly use their inhaler. Strategies must be in place in order to ensure treatment plans are being followed. It is very important for the person to maintain regular exercise and social interactions. Recognition and early treatment of exacerbations is important because it can help you seeking the treatment that you need as quickly as possible. An asthma action plan is also something that can be a very handy tool for a person when they experience an asthma exacerbation. Asthma diaries are also kept so that a person can write down when their exacerbation occurs, what triggered it, and any other details that they can in order to educate them for future reference. Here is an example of an asthma action plan. It is recommended in case of an emergency. There are different versions available from the Center for Disease Control. The address is shown below. Thank you very much for listening to my presentation. For more information or for any questions, please contact your healthcare provider. Thank you.